Growing up, my mom actually worked in an OB office just down the street. She was a medical assistant and she ran all of the physicians. So back then it was okay to go to work with your mom occasionally. So I used to go pretty often and sit in the doctor's offices. And that's kind of how I got into OB. It's just something I grew up around and really loved. There's something so special about being part of women's health across the lifespan. So you can see patients that are anywhere between 13, ages, almost 80. A lot of times my younger girls that have just gotten a menstrual cycle, they'll come in, and typically the first year it can be very irregular. Typically then is just kind of establishing a relationship, getting them to know their body and know what to expect over the next couple of years. And then as we get across the lifespan, we have a lot of patients that have PCOS, heavy menstrual cycles, ovarian cysts, just wanting birth control, all sorts of things like that. And then once we get into the menopausal phase, I really try to work with my girls on menopausal symptoms. So knowing that they don't have to go through things, we have medication that can manage it. We have more holistic routes that can help manage, hot flashes, night sweats, things like that. I love delivering babies. I love being a part of like a women's whole birth process. Typically the first visit, you come in, first thing we do is we just introduce ourselves, kind of get to know each other a little bit. Your medical history, just make sure you don't have any risk factors that would consider you a little bit more high risk, anything that we need to monitor throughout the pregnancy. And then towards the very end of that first visit, we talk about all the education stuff that involves pregnancy. Knowing at the end of the day that I have helped someone, I know that can be a little bit cliche to say, but in the OBGYN world, there's a lot going on and there's a lot of difficult things that people have been dealing with for a long time. And I really try to make it my goal to make sure that we can fix those things. I'm just me. I come in, we have a great conversation. There's nothing to ever be scared of. If you've gone through it, I might have gone through it too. So from a lot of experience, I can make sure that you're comfortable and we can get things back to normal for you.